Alrighty, so today we have Bonny Graham, head of nursing. She's here to talk to us about the UK variant. So the first question I have is, what makes it a variant and what is the difference?
We first heard of COVID-19, the virus, in December 2019, and since then it has changed quite a bit. And so in order for the virus to continue to be infectious, it has to strengthen itself and mutate in order to infect people.
All right. If you're variant positive, how many days do you have to isolate for?
10 days or until your symptoms subside.
Great. If you are a close contact to the variant, how many days do you have to isolate for?
14 days.
14. Are the variant symptoms the same as COVID?
Yes.
Okay.
The majority of symptoms are the same, yes.
Okay. Can a regular COVID-19 test detect the new variant?
No, it can't. Unfortunately, it just detects that you're COVID-19 positive. And if once you're identified as COVID-19 positive, they send it away. Not send it away, but they do further testing. It takes another 2 days to determine if you're variant positive, and then it takes 1 or 2 more days to determine what kind of variant you might have. So right now in Alberta, the majority of variants are the UK strain, but there are other strains called South African and Brazil.
Okay. If I were to test variant positive, what would I do next?
You would likely get a call or a text from AHS as you preferred on your requisition when you were tested. And then the first thing you should do is stay calm and isolate from your family in an area in your home away from the family as soon as possible. A nurse will be calling you to confirm that you are variant positive, and we'll discuss the options for isolation with you. So you do have options. You can go to a variant hotel, or you could go to one of our trailers here in Ermineskin, and or you can stay in your home. But the preference is, if you're an adult, that you do go to either the hotel or to one of our trailers. And that's just to prevent infection throughout your home.
Okay. And to wait, did I already ask that? If I get the vaccine, can I still get COVID-19 variant?
Yes, unfortunately, when the vaccine was made, it was to protect you against the coronavirus, COVID-19, and since then it has mutated as we discussed. So we can still get the variant, and it would be most likely very mild because the vaccine has been found to be very effective against the variant. So should you get the infection, it would most likely be a very mild form of the variant.
You mentioned isolation. Who would I contact if I wanted to isolate in the trailers or the hotels?
When the nurse calls to discuss what needs to happen with the COVID-19 variant, she will also give you some options about isolating, so that is the first person that you can discuss it with. Otherwise, you can talk to your DEM in your nation. And please do not just drop somebody off at the trailer. It has happened. We do need to have a heads up. We need to ensure that everyone working there is also protected. And so we do have a process. So if you are a variant positive and wish to go to the trailer, you can discuss that with the nurse that called you, and we will talk to our medical director, who is Dr. Toth, and arrange admission for you at our trailer. Otherwise, you can call 211 and they will assess you for eligibility to go to the hotel. And just so you know, I understand that once you complete your isolation at the hotel, you may be eligible for $625, and that's managed by the province, and they arrange you to fill out the forms that are required and such.
Okay. Is the incubation period the same for the variant in COVID?
Yes, the incubation period is the time from your exposure to the virus to when your symptoms occur. And so it's up to 14 days, but we have seen as early as 2 days post-exposure to up to the 14 days. And on a rare occasion, it's taken longer. But generally speaking, most people who get the variant and or COVID usually have symptoms about 5 days after the exposure.
Okay. I heard if you're a close contact to a case with the variant that the household is put on isolation. Is that true?
Yes. So we follow the Alberta Health Guidelines, and that's to manage and protect people against COVID-19. Now, these are the minimum guidelines that we must follow. And after careful consideration, the medical experts are medical officers of health at Health Canada, work close with Dr. Hinshaw. That's the chief medical officer in Alberta. And after considering many different reasons for protection of people in the community, they've decided to take a very aggressive stance to prevent and contain COVID-19 variant. So the UK, the Brazil, and the South African strain. And so far there's just the UK in this local area. And so the reason they want to protect and take that aggressive stance is because they want to protect the most vulnerable, so our elders and our chronically ill people. And they acknowledge that we have homes with multiple generations and crowded living conditions with several people living together. And because the variant travels so fast and can spread so fast, this is the reason that we want to quarantine the entire household. And preferably, if the person is an adult, to have that person go to either one of the hotels for COVID-19 or to the trailer.
Okay. And does the variant make people sicker?
The variant doesn't necessarily make people sicker, but it does travel very fast and can spread very quickly. And again, that puts our elders and our people living with chronic conditions more at risk for getting the disease.
Okay. Is there anything you'd like to add to?
Yes, I want people to please continue to follow the guidelines. So I know we have reduced cases now, so we're down at 13 cases yesterday in the community, and that's a big drop from January. But please don't let your guard down. Continue to wash your hands, cover your cough, stay home when you're sick, get tested if you have any symptoms. And also, beginning in the week of March 29th, we're going to start our next rollout of vaccines. It's going to be the Moderna vaccine, and it's for the age groups of 50 to 64. So please watch for the posters on social media and listen to talk radio for updates as to when and how to get an appointment.
Okay. Well, thank you very much, Bonnie.
Well, thank you for your time, Rebecca.
All right. You have a good day.
Take care, everyone.